The budget-making exercise is a legislative process in line with international practice and principles of good governance. Our Constitution stipulates that Parliament must facilitate public involvement in its legislative and other process, including process of its committees. This exercise is also provided by Order number 20 of the National Assembly Standing Orders and Rules, particularly on monitoring, investigations, inquiry into, and making recommendations relating to any aspect of the legislation programs on budget policy or any matter it may consider an aspect of legislative. Budget consultation. The purpose of budget consultation is to elicit budget views and aspirations of as many stakeholders as possible across the country. As we speak here, there are 4 other groups that are scattered all over the country, and I believe all the 10 provinces will be catered for at the end of the day. Budget consultation has become an important tool for Parliament to give feedback to the citizens of Zimbabwe on their contributions. And I believe you have also received some documents on what we shall be doing this morning or at a later stage. The budget consultations are also guided by the budget strategy paper, which is normally tabled before Parliament by 31st of July on a yearly basis. Hence these meetings today. The Budget, Finance and Economic Development Committee is responsible for providing oversight on the Ministry of Finance and Economic Power. It is, in fact, the custodian of the budget-making process, that ministry. The expanded committee is composed of all chairpersons of the portfolio and thematic committees. It was so expanded or so established because the Parliament realized that the Social Sustainable Development Goals, normally called the SDGs, cut across all sections of the economy of Parliament. Hence, the interest of the SDGs in budget-making process. What will be our public hearing rules? First of all, we are allowed to make your presentation in any language, but provided that language falls within the 16 languages that were approved in our Constitution. Participants are protected when they make their presentations under the Privileges, Immunities and Powers of Parliament Act. That means you are free to express your views in any way you want to express them, but you must not use derogatory language.
I believe almost everyone who got in here got this pamphlet. So if we open to page 39, that would help us to number 14 and public service, labor and social welfare. The money is 237. So if you all had what everyone was saying, which are social grants and the social welfare is not really enough funds. There are funds that are allocated in other expenditures that I don't feel belong there. So for me, it would be where is that? I can't really find the number 89. All right. Here on the number 26, science and technology development, we are evolving and as a country or as a world, which we are in the whole internet evolution or internet time. But I'm working the efforts that we are doing as a country to implement that. So if the 89 million is removed, if I were social welfare, it can then cover all these other elements as social welfare, infrastructure development and rehabilitation. The number one is health. It's 6.57 billion. I believe it's the very important thing, Katisi. We are in the COVID-19 era, we are in the in fact, everything is just in shambles, it's not there. But we are land, agriculture, water, and climate. I need to put my in name or in Lituania. We can prioritize the water and the healthcare system versus social services. So if the money is keep a fraction from all these other that are not as important, I have a healthcare and water, and then obviously the social part that they benefits me. No, but if 300.
Are you not looking at 20 budget?
Yes, it's the
What do you think about 21 budget?
it's the 2020 budget that we want right. This is what?
This is spent already. This budget we're talking about is 21 budget.
Yes, we're talking about the 2021 budget. But some of the money wasn't spent. That's what I'm saying. I'm referring to the money that wasn't even spent. Yes. Yes. I'm referring to the money that wasn't spent. Which might increase from the 2020 going into the 2021 budget. These are the things that we need to look at: health and care, water, and then the social welfare. Keep Panama franchise the money we went from the less important one into the 2021. So that's my contribution.
I really normal.
I said to the song. Yes, not to take at the social welfare representing about 2 months ago. So if you go, if they're saying they spent this money, it's been doing up to 2 months ago. I'm saying, did you just say that this is been spent? You just look at that, which is spending on any money. So,
So we want to further buttress in the issue here, increasing health financing to the 15% markup is per the Abuja Declaration. Within that aspect, we want to talk about investment in health emergencies and health in emergencies. I think one lesson that COVID-19 has taught us is that we are not ready as a country when it comes to responding to emergencies. Sometime in February, Sasi Parade on TV saying we are more than ready, visiting hospital, jumping from hospital to hospital. But Katesi, right now at this position, we have actually shown ourselves we are not even ready at all. The second issue we want to talk to is to strengthen our health systems. When we are talking about strengthening health systems, we are talking about strengthening health beyond the facility itself and looking at issues to do with social determinants of health. Right now, the issue to do with COVID-19 prevention, Asila vaccine, right? But we are taking prevention measures, and one of them is we have to do hygiene practices and wash our hands and everything. Asila manzi. So if we're going to talk about social determinants of health, we're talking about all the other enablers of health that are around the health system, beyond the facility. Water and sanitation, the roads for the ambulances. Right now, my ambulance, my health facilities, at least best with dinner, because we have got Efileo and everything. The other thing, which should be the last we want to talk about, is let's look also in issues to do with domestic financing. Through amassing taxes, let's see what else we can do to domestically finance our health system instead of depending on global fund and stuff. Replication of AIDS level system enjalo. And another lesson that we should take from COVID-19 is ukuthi health tourism. Kukhona lapha engasebenzi khona. I-COVID-19 isitshengisa ukuthi you go back to your health facility, whether you are a minister or you are whatever, you need to go back to your health facility. So in that cause, let's look at investing in our health facilities. Ngoba at some point in time, kuzafunakala ukuthi uhambe lapha ovele khona ungaye China. So let's look at domestic health financing. Thank you.
I want to first of all emphasize the points that have been laid out before me, that there is the need, as we have committed as a country, first in the Abuja Declaration and second in the ICPD, to ensure that we eliminate maternal mortality, and also that we are going to increase our investment for adolescent sexual and reproductive health. And as such, we call upon government once again to ensure that 15% of GDP is allocated towards the health budget. And number two, I want to speak to an issue that was raised earlier on with regards to sanitary ware for girls in schools. So $200 million was allocated for the 2020 budget, but 67 million is what was then dispersed to the Ministry of Primary and Secondary Education. But out of that 67 million, only 33.3% is what was spent. So the issue that we have now with regards to our budget as a country is that we have a mismatch between allocation and expenditure. So what that basically means is that whatever we discuss here and the numbers that we discuss and are allocated do not necessarily translate to the expenditure that is then made and dispersed by the Ministry of Finance. So we are asking you as our parliamentarians to make sure that you hold the Minister of Finance to account for these amounts, because he will then come out and shout out all these big numbers and make the nation clap. But at the end of the day, when we go back home, these amounts are not necessarily dispersed to the ministries. And then thirdly, I want to speak to the Education Amendment Act. The Section 4 of that act speaks again as well to say that the Ministry of Primary and Secondary Education is mandated to provide sanitary ware. So what that basically means is that this is not a choice that you have as Parliament to make sure that this sanitary ware is allocated. It is a must. And as Dr. Ruth Laborde said, that 200 million that was allocated in the previous year, we want it in US dollars because of the factor of inflation. That $200 million of last year will not suffice this year. So that $200 million should be multiplied to the factor of inflation. That is by 4 to make it a maximum of 1 billion Zimbabwe dollars. And then we are also advocating as well to ensure that the government of Zimbabwe should introduce tax breaks and tax incentives to ensure that the private sector plays a critical role in the health industry, as it were. Because what we are seeing today is that the government has failed, literally, to finance the health sector as it is. Because 65% of our health budget is financed by donors and other development partners from outside of the country. So why not then incentivize the local industries to make sure that they contribute to the health budget in the country? To add on to that, we're also asking that the government should ensure that at least each and every ministry contributes a minimum of 10% towards health from all the ministries that are pushing through. Because whatever ministry is serving in the country, there is an element of health that is coming out for everyone. Be it health, be it agriculture, there is a health component that is also served within that budget. And then last and finally, not least, We are advocating education through the Ministry of Labor and Social Welfare, as they say. They employ SRHR personnel in our schools. What we are seeing currently on social media, as some of you are, is that what our children are doing is a violation of sexual and reproductive health, as it were. Why? Because they are not getting the comprehensive sexuality education that they are supposed to be getting. And we have a school health policy that is not financed. So it's just a policy that is hanging in the air. Now we are asking that you allocate a budget towards the employment of SRHR personnel such that our young children and young people in schools are educated sufficiently so that we don't see any more of these interesting videos that we are seeing on social media. Thank
you. Last term, 2019, was not adequate to cover areas of expectations. Area number one of concern, which I feel something must be done as a matter of urgent, is on the mental health cases of our people. If they don't get the required prescribed medication, what it means, munhu iyeye anopinda mu-street. That patient akashaya enough medication, the mental health cases vanopinda mu-street. Takazviona last year kuti pavanoenda ku-ministry kuti vanowana those tablets like from Gucheni, just to mention institution which caters for mental health cases here in Bulawayo. Tine and Gucheni. So when they go there to look for the medication, they are told they are not there because of abasisinaman. That's a major challenge. Two, good disability board. The disability board is there through the Act of Parliament, and we have got.
Can I just interrupt? If it's possible for you to indicate how much you are expecting from the budget, you might tell us.
The ministry as a whole.
You said the budget for last year was not enough, was not adequate.
Yes.
For your organization. Are you in a position to tell us what you think might be enough for your organization?
Okay, thank you very much. Because last year we allocated the 2.3 billion, which I feel is not enough. I'm looking at something above 5 billion.
Okay.
5 billion, I think, would do us much better. Because, like in the case of the disability board, we are supposed to be meeting quarterly. But you find out that we are not able to meet quarterly because at the end of the day, we are told a budget a pasisina man. That is what we are told. What has been allocated has been consumed maybe by one sitting. Then the question comes to say,
but you have covered that. You keep on repeating yourself. Okay. You have told us the budget was not enough last year.
Thank you very much.
You don't need to repeat it.
So much for the opportunity. The organization is Transparency International Zimbabwe. I think our submission is that overall there is a need for transparency and accountability in terms of the budget projections, and maybe later on the expenditure part of the budget, because yes, we get an idea of how much the country is budgeting, but the expenditure part of it around issues to do with the monitoring, around issues to do with the integrity within the usage of those funds. Lastly, we are aware that there were COVID-19 funds. They've got budgetary implications, so there is a need for accountability in usages of such kind of funds, because they've got a bearing on the national outlook of things. So for us, the call is around the need for transparency in terms of information dissemination for the public, because in as much as we've got this meeting, maybe the dissemination methods of such information need to be improved. Thank you.
Those who are employed, a lot of people are able-bodied. The disabled people, they are not being employed by directly on. I think something must be done there as well. As much as we want to be employed in other companies, even Jaros here as well, there are a lot of able-bodied. Go to kitchen department, able-bodied. Go to boarding, able-bodied. Go to the office, able-bodied. Where are the people who train secretarial? Where are they? Why are they not being employed? Even Jaros here too has a blame from the head office. I don't want to do a presentation. I think you've got my point. Also, Jaros, the head office, they should put their house in order. They should also employ and track those people who are disability, who did courses. Even whether it's a gardening, they should put those deaf people to be in the garden. But you see them employing an able-bodied person. Even from the manager can walk. How will he understand the issues of the disability? I think a disabled manager must be there. The director is an able-bodied. A disabled director must be in that office. That's what I'm thinking as well. So that he can address, he can understand the issues. If I say my wheelchair's got a problem, if he's using a crutch or a wheelchair, he can understand me. But if an able-bodied, if I tell that person that my wheelchair's got a problem, he won't understand because he doesn't feel the pain of being a person living with a disability. I think Jaros Chiri, the government must intervene how they employ as well. Thank you.
When it comes to our health budget, it accounts for 10.2% of the overall government expenditure, which more than 80% goes towards the wage bill. That leaves medicines and commodities gap in the health sector. So what we are asking for is that can the government increase the percentage that is allocated to health sector as per Abuja Declaration. If we remember in the Abuja Declaration that Zimbabwe signed, we agreed that health sector should be allocated 15% of the total budget. Can that budget be allocated to health? And also, can also the mining companies contribute in terms of developing health institutions? Can the government stop giving companies that are mining in Zimbabwe tax holidays instead of those companies to improve our communities? Thank you very much.
The budget should include medical equipment for the medical students, those who are into our future doctors. So currently they are buying their equipment for use, or their laboratories are not also in a proper condition. So our plea is to say that the budget should include the medical equipment for those students. Secondly, the budget should be flexible in a way that it should be allow for a subsidy for the fees of all the students in all tertiary universities. If it is possible, we can even get ZUPCO education, a subsidy of the fees. So that, because it is hard for the students to learn at this particular point in time, knowing that their parents are getting a little amount of money. So we need it to include the subsidy. And lastly, we are the future teachers. The future teachers, those on attachment, they are getting something which is closer to 150 RTGS. It is not even, it's not even enough for him or her to board a bus from day one up to the last day of the month. So we are appealing for the budget to include the money, or in a way the money for the future teachers of the country, since they are more important for the future of the nation. Thank you very much. For the teachers, our proposal is simple. It goes like this. We are proposing the government to set aside a money that is responsible. Or in terms of figures, actually, in terms of figures, we are. Oh my God. How much money? Yes. Money.
520, yes.
Approximately 10,000 and above. It will work out. Hello? Yes. Yes, for each person. I'm not hearing you well, sorry. I said 10,000. For one.
And we are concerned about young people accessing enough funding to be productive and to contribute to the economy. We are particularly concerned and we need investment in new and improved technologies. And this investment should be for importing and making our technologies that will help our vocational learning institutions and even our traditional learning institutions as well. Qakathekile ukuthi ngo-2020 izikolo zibe sezilama-computer abantwana access ama-tablet ukuthi bafunde. We are also concerned about access to land because it's a means of being productive. We are concerned because young women don't have land, and we are requesting ukuthi i-government subsidize or yenze plan yokuthi ama young women athole i-land a bit cheaper. We are also requesting for direct funding for our youth initiatives that are doing a job that the Ministry of Youth should be doing. And this funding should ensure ukuthi these youth initiatives are directly assisted. And the 330 that was there in the previous budget for the Ministry of Youth is not enough because yaphelela ku Ministry of Youth the administrative processes zabo. So other initiatives that are led by young people in the country also need funding. Yabo. Kule budget bekule 330. Well, that will then require in-depth research from a department. If it saying at because the LAPA saying at 6.5 billion.
Okay, so our first issue is basically on Sandiso Dladla again, Women's Coalition of Zimbabwe. Again, apologies, Honorable, but I feel like the way you articulate things is a bit rude to the rest of the floor. And as we continue, my name is Sandiso. Interruptions, sir. Interruptions, sir. Again, you are interrupting me. I'm speaking. Again, sir, you are interrupting me. I am speaking. I am not done.
Is that women's coalition?
No, ma'am. Apologies, sir. Apologies, sir. Apologies, sir, for the interruption again. Apologies. As I continue, my name is Sandiso. I am speaking for Women's Coalition of Zimbabwe. Apologies for the interruption.
Okay, go ahead.
My first contribution is on the transparency and accountability for the budget, the funds received. For example, can we actually know how the funds will be dispersed, especially, say, for example, let's look at the COVID-19 funds. If we are getting funds, can as a country be told how they are dispersed and how they are working, so that we at least know as citizens how they are accounted for? Second of all, we are actually asking if women and the youth can also be included in the investments for the growth of the economic situation. And then lastly, the free sanitary 200 million that was set aside in this budget. What happened to it? Because we are not aware of the free sanitary wear that was actually given out. But at the moment, we actually have a price hike, and sanitary wear still actually has duty. So we are not aware how that helped out or how that happened. Can you actually have clarification for all those things in this current budget? Thank you.
You still want another budget for this year?
Yes, we do.
For the sanitary?
Yes, we actually do. Sanitary wear is essential for the local.
What will you do last year?
200 million.
200,000. What are people in this budget?
This budget would actually look at maybe about $1 billion for the girl child.
I just wanted to ask you, seeing as the 200 million was not even allocated, what is your guarantee that if you push it to 2 billion, then it will be allocated?
We have no guarantee, hence we are actually asking the nation to actually please consider the girl child and put the girl child first, because they're actually affected by this, especially children in the rural areas. Yes, we can do drive for children in the urban areas, but children in the rural areas are deeply affected by sanitary wear.
No need for you to be emotional.
Emanzini ngithanda ukuthi ngikhulume ngento yamanzi. Silodubo lwamanzi ma members eParliament. Isikhulumile sikhuluma ngohlupho ukuthi siseBaba Fields. Nxa sisiyacela esibhedlela akulula. It's true akulula, kodwa empilo sesifake ama-boreholes ayi-4 OS5 usalungiswa. Ngenxa yokuthi nxa ebesiba khona la awe-council abe khona aphinde aphele, but ngizafisa ukuthi ngimpone isikhulumi ebesikhuluma ngamanzi ukuze ngikhulumisane laye sibonisane ukuthi siyofaka ibhoholo lapha bangatsho khona. Kanti-ke uhulumende uncedise kakhulu. Inyamendlovu Aquifer isinika on daily basis 10 megawatts into the city, angena kumagwegwe reservoir. As we speak, basa finalizer abasebenza ku-Epping Forest, layo izasinika by end of October sizabe sizuza 10 megaliters again. Ihulumende iphinde yafaka imali ukuthi kube le pipeline from Imchabezi ukuze sizuze amanzi angasincedisa koBulawayo. Nxa bebekhuluma ngamanzi ngodubo lwamanzi baqinisile kakhulu, silalo udubo lwamanzi, kodwa kule mzamo enziwayo. Siyabonga ku City of Bulawayo ngemzamo, sibongela ku central government bebe complimentana ukuthi sincediswe kungabi lamanzi azasweleka completely. Ku health institutions, we are so thankful to i-COVID-19 yenze sazinuka amakhwapha njengabantu bakoBulawayo. I-Thorn Grove ibivelisi ihlakazekile I'm happy ukuthi iSong Groove ivuselelwe kuhle iwing le yonke ngapha kuze kwafakwa extra rooms kuhle kakhulu so kuyindawo yokuhambisa abanye bethu ababe bethe bahlaselwa ngomkhuhlane lo. Ebusileni sikhangelele ukuyivula ebusileni isiphose yaphelela selinto ezincane kuhle sibonga abantu bakobulawayo i-business community yakobulawayo lohulumende labantu abaku-diaspora basincedise kakhulu ebusileni yavulwa. Lingafika e-UBH kule ndawo kule building enkulu ebisetshenziswa just for the elderly people. It was an old people's home, but Bishop said about 3, 4, 5 people. Esesibafake kwezinye indawo yarenovatwa indawo leyana. Xa ufika khona uzabona ngathi ungena ePharanyatha. Isibhedlela lesiyana sesisikhulu kakhulu i-UBH. Sibonga i-COVID ukuthi yenze sahamba si-identifya ama-buildings abese-neglected aselungisiwe. Ngokuqhubeka kwesikhathi sizafisa ukuthi sisebenze sindawonye ukuze akulankwali bakithi eqandelenye akula Bulawayo asenzeni esifisa ukuthi iBulawayo ikhangeleke ngakho ku-industry wonke ama-buildings lawa ama-factory wonke lokhu engaphansi kwe-judicial management kuyasihlukuluza sonke. Abanye babethatha amaloni emabhenki umuntu engabe sabhadala kungangena ekhoti akulula ukuthi uphonge utshaye i-shortcut kumele silandeleni umthetho. Ngibe sengibonga gcina isihlalo ama-observations ku-social welfare kuqakathekile khonokho bekulethwa ngabantu kufuna sihlaleni phansi sifake nama-ideas zethu ukuze iParliament ikukhangele besikhalaza ngakho ama-contributions wonke labeyifaka ku-sanitary way. Ngiyafisa ukuthi alubana imali lezesithi kalubana ziyangezelelwa ziphiwe abantu abatsha beqalise their own businesses to produce i-sanitary wear ngoba le wodwa outside the country ikuyiduliswa ngabomo. Umuntu into ayithenge nge-10 rand ngapha efike ethi $10 kuba unfair ebantwini abatsha nxa bengasekelwa ama-businesses abo kungaba kuhle kakhulu. Ngibe sengingena ukhona okhulume nge-issue yama-ambulances which is very key langokuthi esipholiseni ize-therapy ayihlonyiswe ukuze bebe effective. Imbono emihle kakhulu. Ukhona okhulume ngokuthi bona bengeke kuthiwe bayi-empower ngama-sunlight liquid. Ama-detergents yi-business on its own. It's a product esingangena kiyo sibe ku-business. Abaningi basebengenisa kuma-supermarket. Ngicina isihlalo siyabonga kakhulu ukuthi lisiphathele umsebenzi wethu wobulawayo omuhle. Siyabonga inkosi ilenzele kuhle nxa libhoda phakathi kwelizwe.